Start off this patient with a great botulinum toxin Botox treatment here, and we've cleaned off the skin. We've marked her exactly where we want to put the Botox here, and you can see we are using a ComfortDoc syringe with the right dosaging for here, which is determined by her eyes. Does she have deep, shallow, medium set eyes? That's going to determine a lot of this, plus the muscle mass and how she contracts, and has she had Botox before. So with her, we are giving her a reasonable dose to make sure that we are going to take out the action of the frontalis, also going to get rid of any headaches, but we are putting this right near the dots, not in the dots, and this is going to slip right in, and we're going to get into the frontalis muscle, which is not much underneath the skin. If we touch bone, we will then pull back. Now we are going to do the glabellar area, and this is the procerus muscle, as you can see right here. She doesn't need much here, so we are going to go ahead and give her what she needs. Look how we are holding these muscles. That is crucial to make sure that the Botox stays exactly where we want it. And this is true of any botulinum toxin. This is a very precise procedure, and you've got to understand that we are placing this exactly in the muscle, going to keep it there. If I held that muscle differently, that would then leak down to some of the eyelid opening muscles, and she would have trouble opening her eyelids, and that is not what we want. So the technique is everything to get a great result. And as you wipe up the patient, you're always wiping up and away from the eyes as well here. So now we're going to go ahead and give her some in her crow's feet here, and we are going to isolate that tissue, stabilize it. She only needs one injection. Very precise per patient too. This is very individualized treatment. You see some patients getting 3 or 4 injections on the side. She doesn't need that. All she needs is one. You've got to know exactly where you are, so you are in the lateral apicularis oculi and no other muscle. Now we are going to masseter and temporalis. She does want more of a heart-shaped face. We're going to bring that masseter in by giving Botox right into the bulkiest part of the masseter, which is different on everybody. And it's a fast injection, as we see. Make sure you're in the middle of the masseter. Too anterior, you will affect her smile if that Botox gets to any other muscle. Now this is the temporalis muscle. You don't have a choice but to have to go through the hair, but the hair and this area has been cleaned off really well. As you can see, you want to clean it off even if it's got hair on it, because that will help disinfect the area very well. And then you're going to find the bulkiest part of the temporalis, which is going to be different on every patient. You're going to go in, you're going to give it as fast as you can. It's not fast enough. There's no reason to go slow. And this patient, 2 areas that bother her and 2 lumps of that temporalis muscle when she bites down. That's the most active part of the temporalis. And now we're going to go to the other side, do the same thing on the masseter muscle. So here is this masseter injection right into that area. Give it fast. There's no point in giving it slow. And you can see the patient barely feels anything. And now we're going to go ahead and do the same thing on the temporalis muscle over here. So that doesn't take long, but it doesn't take long unless you're really well trained. If you're well trained and also really know the anatomy. This is all about knowing the anatomy. AAFE, great technique training. That is how you get the best result and the least amount of any kind of complications or side effects. And this patient won't have any. Clean off real well. Going to give that right into the temporalis muscle. Patient's going to get a lot of relief, but also going to get a beautiful facial aesthetics from all of this botulinum toxin treatment here right now. Here you can see the full face, post-lip enhancement, post-botulinum toxin treatment. She looks just great. You've got to learn to do all of this treatment. Add it to your practice today. Time for you to get AAFE certification trained today.